are not in place, distancing, masking, whatever else needs to happen? And does that also then say, does that give us a red flag as far as vaccinations are concerned?
All right, Julie. So from your introduction, I think there's two things I want to talk about. Firstly, is this the right thing to do? And secondly, your concerns about safety. So remember, in terms of is this the right thing to do, it absolutely is. Children, it's not the first time that children are going back to school. We know that children have been back to school at various times during the lockdown. They go to school, then there's another lockdown, then they go back to school. The big difference now is the rotation system has changed. So instead of children going half the time, now all children are going all the time. 80% of primary schools were already were going all the time. The rotation has gone, but it mainly affects the high school children. They'll all be going there. This is the right thing to do, and as I said, I think it is the right thing to do because the consequence of this rotation system has been that over the last 2 years, children have only been going half the time. So we've lost a whole year of learning, and to make up for that year of learning is going to be incredibly difficult. So we having to live with COVID, and we're having to adjust to what COVID does. And so the losses from not going to school, not only is it about the learning, but it's also the school feeding programs in poor schools. It's the fact that children don't have their friends, the psychological and mental effects of not being school. And school are also protection mechanisms. Some children who are being abused and things confide in their parents. So we've thought long and hard about this, and it absolutely is the right thing to do. So your second point, and you mentioned your grandchildren, is this safe to do, and what has changed? So for a long time, we've been having the various measures. We said children must wear face masks, they must wash their hands regularly, and we've said that ideally they should be spaced apart, at least 1 meter apart. So has that changed now? Is it safe that you're less than 1 meter? Because it's inevitable. If there's more children in the classroom, there's going to be less space between them. And the argument and the issue you also raise is about vaccination. Now, the important fact is that there's been studies done in South Africa just before the Omicron came that showed that about 70% of people in Gauteng actually had the infection already. Already had antibodies to the virus already. And the way you get that is either by getting the natural infection or being vaccinated. We know 70% of people have not been vaccinated. So it's a lot of natural infection. And now that we've had Omicron, it's probably up to 80%. So the same applies to children. About 80% of children are probably or are very likely to have also been exposed to the virus, not through vaccination, but being exposed. But because children don't get lots of symptoms, we don't pick up the infection. So your question was, should all children be vaccinated immediately? And the answer is, it would be nice, but it's not necessary because most of them have been exposed. So one last point, and then if there's anything further, the issue is less than 1 meter safe? And I think what we've recognized is that, sure, the further you are from another person, the less chances of infection. But we now know that a lot of this virus spread is not through touching things or not from coughing and sneezing, what we call droplet spread, but in fact the virus is in the air. It's called aerosolized spread, meaning that someone could have been in the room and gone out, and 10 minutes later you walk in, the virus is still around. They don't have to cough or sneeze on you.
Oh, no.
So that's bad news. But the best way of dealing with that is a good ventilation. So the space business is less important, but the classroom, the teacher should open the windows, should open the doors, make sure there's lots of ventilation. Ideally, you can even take the children out into the playground or teach them outside under the tree. That's even better. The point I'm making is a lot has changed since we started the lockdown, and so we have to understand the environment and adapt to it.
So, Professor, I have to ask you this question then. You're talking about, obviously, the droplets being in the air.
Right.
Does that not then suggest we have to mask up all of the time? And how does it impact, with offices and even homes that have air conditioners? What are we saying when, you have your air cons on full blast? Is that going to help, or is that possibly, further impacting on the problem?
All right. So let's go to the aircon issue. The aircon issue, it depends what kind of an aircon you've got. Some aircons can actually extract particles out and filter them. Not all aircons have got that, but clearly, if all the air content is recirculate air, it actually does increase the risk. What that means in terms of face masks is that what we're realizing now is that better the face mask, the more protected you are from what we call this aerosolized spread. So it's like in the air. So the ordinary cloth masks are not that effective. They're probably about 50 to 60% effective, which means they are effective, but they're not as effective as the medical masks. Those are probably about 70% effective. And then the stuff that doctors and nurses and health staff use in the hospital, what I call N95 masks, are the best. And so in the United States, for example, they're actually giving these children these more expensive masks, the N95s, because they're better protective. So what I'm saying is, yes, continue wearing the mask, but if you can, rather wear the medical masks, those blue ones, rather than just face masks. And you can get N95 for your child or for yourself in the office, get those. So as you see, the science is evolving and our understanding is changing all the time, and our recommendations change based on that.
Okay, Health Minister Joe Pahla has said that the overall infections have reached a plateau. I suppose meaning that there's no serious decline and no worrying rise in infections. Would you agree with that? And with, Alhamdulillah, we are in, still our summer months, but on the 1st of April, we'll be in autumn. I'm wondering what the winter months is going to look like here in South Africa, given what we're seeing playing out in, in the Northern Hemispheric countries.
Okay, so in terms of the Omicron, which we've just been through this wave, all indications are that we're over the worst of that. So the number of cases are coming down, but more importantly, at this stage, I'm not that interested in number of cases. I'm interested in how many serious cases there have been, which means people who've been hospitalized or worse who have died. And we've seen those numbers have come down a lot. So all of that suggests that this wave, we're now over the worst and we're coming to the end of it. But as you rightly say, that is there going to be another wave, particularly come autumn or winter? And it's almost definite that we are going to get another wave. What it will look like, will it be more infectious than the Omicron? Will it be more serious than the Delta? Obviously, none of us can predict. But the one good thing is, as I said earlier, that probably about 80% of us, whether through natural infection or vaccines, have got some protection against the coronavirus. And so as we get into autumn or winter, that protection, even if it's a different type of virus, will continue to help us. The vaccination or the exposure to and so we probably will have milder strains as we go forward. One can't predict this. And so, sure, we are going to have another wave, but I don't think we need to be terrified that it's going to be causing more mayhem. Inshallah, it will be less serious, and at worst time, we will find this virus becomes more like the flu, because all of us have been exposed to it.
Okay, so I'm also hearing noises from different quarters suggesting that perhaps the days of the face masks are almost, at an end, that sooner rather than later it won't be necessary to be wearing face masks. But you're not in agreement with that, are you?
Yeah, so in fact, just last week, there was a study in school children in America they looked at the whole country and said schools where children were wearing masks compared to schools where children were not wearing masks. They had all the other PPE, personal protection stuff going, but it was mask or no mask. And they found that the schools where children were wearing masks were about 14% less likely to get coronavirus infections, 14%. So clearly there's a role for masks. It's not the only thing. We must do all the other things. I talked about ventilation. I talked about continuing to wear face masks. But I think in the current environment, you're still safer wearing a mask than not wearing the mask. It does offer a layer of protection. Can you take it off? And because, as I said, most of us have been exposed either through infection, you possibly could. But certainly at the school level, I'm saying at least for the next, until we're sure what's happening, your children should continue wearing masks. If you're going to office, continue wearing masks. But it's very likely that perhaps in the next 2, 3, 4 months, we'll say, no, we're over the worst, let's stop wearing masks. So yes, I'm saying for now, I think you should continue wearing masks, particularly if you're indoors. When you're outside, because there's less aerosols spread, it all gets dispersed. I don't bother wearing a mask. But if you're inside and there's poor ventilation or in the classroom, do continue wearing the mask for now.
Even in your own home, I should imagine, just for each other's
No, not in
protection.
your own home. I mean, I would not in your own home. Clearly, the people in your own home you've been exposed to. So it doesn't mean there's no risk at home. We know that more children have been infected at home than at schools. Another study last week showed that the best way to protect children, here's a key message, is for their parents to be vaccinated. They found that
Mm.
those parents were vaccinated, there were much fewer children. So rather than worrying about vaccinating children, make sure you are vaccinated. But in the home, no, I don't think it's reasonable to wear masks. I'm talking about when you go into public spaces.
Professor, at the start of this, this pandemic, I know that we were all going rather crazy. There was that whole issue, should you vaccinate, shouldn't you vaccinate? Then there was that big drama about the certain medications that doctors were. Some were against and some were not. Ivermectin, that was the big story going around, that was supposed to be the miracle cure, or that would lessen the severity of the disease. So there were all of these ongoing discussions and debates. And then also, above all of that, they were suggesting, some of the experts, so called experts, were suggesting that at risk people should be going on a multi vitamin regime, like your zincs and your vitamin C, vitamin D, etc., etc., etc. Some of us have been religiously on that regime. Is that necessary?
All right. So I speak as a doctor, and I'm also a scientist, and so the only thing I can tell you absolutely works is vaccination. I know there's lots of people who've got stories, have got things about this happened to the neighbor or the person down the road that they took the vaccine and they fell down dead the next day. But we've got so much evidence on this. We've been giving around the world vaccinations work. So that's the only thing that works. Your question is, do these other strategies work? I find it crazy that people don't want vaccination, but they'll rather get the virus and then take all these other concoctions like ivermectin. But there's so many others. And these are all have not been proved. We've now got the evidence on them. And all of them. There are some very specific new treatments, very expensive treatments for COVID if you can afford them. But things like ivermectin has been discredited completely. Your other point is, so what about better diets or all kinds of different concoctions? And again, you won't find evidence for them. Firstly, there's been very few studies of them, but where some of these have been exposed to proper studies, there's very little that by taking more vitamins or by taking particular type of herbs and things, that they make a difference. Now, I'm not saying that they may not work, but what I'm saying is we don't have the evidence. And a lot of people spend a lot of money on these things and spend a lot of time otherwise trying to get the herbs or get the concoctions. Short line, Julie, is that there's no evidence that any particular diet, any particular vitamins make a difference. The message is take the usual steps that we've talked about already, and please get vaccinated if you haven't been vaccinated.
Inshallah. Anything else you'd like to leave us with before we wrap up for this morning?
Yeah, so our starting point was just parents' fear about children going to schools. The education department will be monitoring. I do expect that a few children who haven't still been exposed, may get infections. But we're not expecting big outbreaks of COVID in schools. And certainly the idea that children will get COVID at school and bring it home and then infect granny or auntie is probably a very small possibility. So I don't think people have to be afraid. I think the school opening is a great thing. It was long overdue, and that we're not going to see mayhem because of it.
Okay, I'm just thinking, I did say it was the final question, but one thing has just popped into my mind. At-risk children who have some form of comorbidities, and we do know that there are some sick children that ought to still continue going to school. How do we protect them in these huge classrooms?
So it seems like I'm a broken record. So if you be over the age of 12 years, then those children certainly should be vaccinated. At the moment, only 1 out of 5 children between 12 and 18 have been vaccinated. So a lot of high school children have not been vaccinated. You should take the opportunity. But these high-risk children, definitely, they should get not only 1 but 2 doses of the vaccine. Unfortunately, we don't have the vaccine registered under 12 years in South Africa yet. So those children who are under 12, they need to be protected. And I'd be careful about if they've really got very serious conditions. We're not just talking a little bit of perhaps asthma. Asthma is not a major risk, but children who've got cancer or have got other serious, what we call immunocompromised, they may not want to go to school as yet. But on the whole, we don't have to worry about children with some diseases, even if it's things like diabetes or asthma. They need to be vaccinated, particularly over the age of 12. And finally, about your little two nephews and nieces, I think that's important. There are going to be children coming back from nursery schools with cough, colds, runny noses.
Yes.
And it's obviously very difficult to decide, is this COVID or not? Okay. But I don't think people have to be overly worried, because by going back to school, children are now going to start sharing their colds and their coughs and things, which is not corona. And they are going to come back, but we don't have to be in a panic about it. The question is there something that tells you definitely this is a cold or this is corona? Unfortunately, no. In children, their symptoms are mild, and so they could be having corona. But you don't have to be in a panic, but recognize that more often than not now, it's going to be an ordinary cold rather than corona.
So you don't, all right, so you don't get them tested. It's not necessary. That would be the key question,
definitely,
obviously.
You can't go running with a test every time now. It's only if they're particularly sick, and particularly sick means if they're really having a very high temperature, or if they're breathing very fast. Those may be the reasons to say, hey, and again, it doesn't necessarily mean it's corona. It may be an ordinary bacterial infection, but that's worth taking your child to the clinic or the hospital or the doctor.
Otherwise, you just treat them as per normal for a cold or a flu.
Yeah, that's right. And I think lemon and honey is perfect for a cough or a sore throat. That's
Professor,
my
Shukran very, very much for your insights. Professor Haroon Saloojee, Professor of Child Health at Wits University. The time is exactly 8:45 a.m. This is News and Views right here on Salal Media.
Approximately 785 million people